Good day to everyone. I am Jeffrey Cañete, and this is Psychological Assessment, Scoring Test, and Interpretation. So let us first define what is psychological assessment. This is a problem-solving process of identifying and using relevant information about individuals, groups, or institutions for the purpose of decision-making and recommendations. So the term assessment refers to a complex activity integrating knowledge, clinical judgment, reliable collateral information such as number one, observation, number two, semi-structured or structured interviews, or third-party reports, and psychometric constructs with expertise in an area of professional practice or application. So this includes sensitivity toward the inclusion of diverse and underserved populations. Psychological measures generally fall within one of several categories, including the following. First is the intelligence and achievement tests. So these tests are designed to measure certain specific kinds of cognitive functioning, or often we refer to as the IQ, in comparison to a norming group. So these tests, such as the Wechsler Intelligence Scale for children, attempts to measure such traits as general knowledge, verbal skill, memory, attention span, logical reasoning, and visual or spatial perception. So several tests have shown to predict accurately certain kinds of performance, or especially scholastic. Next is the personality test. So this aims to describe patterns of behavior, thoughts, and feelings. They generally fall within two categories, objective and projective. Objective measures such as the MMPI are based on restricted answers such as yes or no, true or false, or a rating scale. Next is projective tests, such as the Rorschach inkblot test, allow for open-ended answers, often based on ambiguous stimuli. Next is the neuropsychological tests. These consist of specifically designed tasks used to measure psychological functions known to be linked to a particular brain structure or pathway. They are typically used to assess impairment after an injury or illness known to affect neurocognitive functioning, or when used in research to contrast neuropsychological abilities across experimental groups. Next is the diagnostic measurement tools. These are clinical psychologists that can diagnose psychological disorders and related disorders found in the DSM-5 and ICD-10. Many assessment tests have been developed to complement the clinician's clinical observation and other assessment activities. Some of these include the SCID-5 that is most widely used. Next is the clinical observation. These are clinical psychologists that are also trained to gather data by observing behavior. The clinical interview is a vital part of the assessment, even when using other formalized tools, which can employ either a structured or unstructured format. Such assessment looks at certain areas such as general appearance and behavior, mood and affects, perception, comprehension, orientation, insight, memory, and the content of the communication. One psychiatric example of a formal interview is the mental status examination, which is often used in psychiatry as a screening tool for treatment or further testing. It is important to note that tests and assessment are two separate but related components of a psychological evaluation. Psychologists use both types of tools to help them arrive at a diagnosis and a treatment plan. So, what is a psychological test? These can be described as a system of behavior and performance observation that relies on numerical or categorical scale to establish changes and differences. This approach is preferable when there is a need to establish changes and differences over time or between one individual and another. The numerical scale is preferred because it allows for easier comparisons between individuals within a group and establishing the degree of change in a person's behavior or performance over time. Testing involves the use of formal tests such as questionnaires or checklists. These are often described as non-reference tests. A psychological assessment, on the other hand, refers to a process of collecting relevant data using questions, interviews, and observations. Next is the code of good practice in psychological testing. Responsibility for competence. First, take steps to ensure that they are able to meet all of the standards of competence defined by the Society for the relevant certificates of competence in testing, and to endeavor, which, where possible, to develop and enhance their competence as test users. Second, monitor the limits of their competence in psychometric testing and not to offer services which lie outside their competence, nor encourage or cause others to do so. Third is to ensure that they have undertaken any mandatory training and that they have the specific knowledge and skills required for each of the instruments they use. Procedures and techniques. First, use tests in conjunction with other assessment methods only when their use can be supported by the available technical information. Next is administer, score, and interpret tests in accordance with the instructions provided by the test distributor and to standards defined by the society, and store tests material securely and to ensure that no unqualified person has access to them. Next is keep test results securely in a form suitable for developing norms, validation, and monitoring for bias. Let's discuss about client welfare. We should obtain the informed consent of potential test takers, making sure that they understand why the test will be used, what will be done with their results, and who will be provided with access to them. Next, ensure that all test takers are well informed and well prepared for the test session, and that all have had access to practice or familiarization materials where is appropriate. Next, give due consideration to factors such as gender, ethnicity, age, disability, and special needs, educational background, and level of ability in using and interpreting the results of tests. Next is provide the test taker and other authorized persons with feedback about the results in a form which makes clear the implications of the result, that it is clear and in a style appropriate to their level of understanding. Lastly, ensure test results are stored securely, that it should be not accessible to unauthorized or unqualified persons and are not used for any other purposes other than those guaranteed with the test taker. So how can psychological assessment be helpful? For both children and adults, the specific benefits of psychological assessment includes: first, clarifying the existence of specific cognitive disorders. For example, whether a child has an underlying learning or developmental disability, or whether an adult shows evidence of ADHD or memory loss, etc. For those who do struggle with certain types of cognitive disorders, this evaluation will also help inform the types of treatments that may be beneficial for them. For example, medications targeting inattention or memory loss, as well as the kinds of accommodations or supports that are implemented at school or at work as a means of helping the person better thrive in their environment. Next is elucidating the specific type or combination of psychiatric conditions that may be present, which in turn facilitates more effective approaches to treatment. Example is pharmacotherapy or psychotherapy. For example, in cases where someone is struggling with both depression and anxiety, as well as concurrent substance use, isolating these conditions in treatment may be necessary as a means of decreasing their level of interaction. Similarly, in situations where someone may be diagnosed with more severe bipolar disorder and polysubstance use, symptom stabilization and abstinence may need to be jointly prioritized in treatment as a means of preventing relapse. Assessing for certain types of personality characteristics, disorders that may impact functioning or treatment. Let's proceed to the methods of scoring tests. First is computerized scoring. The computer presents questions or tasks and then makes diagnosis and prognosis based on a comparison of the participants' responses or performance to databases of previously acquired information on many other individuals. Next is the manual scoring. So there are two formats. First is marking keys. So basically they consist of plastic, cardboard, or hard sheets containing holes or clear spots in the shape of circles, squares, or rectangles which when placed over a completed response sheet identify the number of the items and whether responses are correct. Most are simple to use, provided that they are correctly aligned and publishers give guidance on this. Correct items can be counted to give a total score in some cases, while in many personality inventories they are totaled or different scales. Clinical assessment will often simply ask the user to count up or to add response scores without keys. A disadvantage with some marking keys is that it is impossible for the scorer to identify irregularities, such as when someone has marked more than one item response where there is only one needed. Next is the self-scoring forms. These have a backing sheet which is sealed beneath the response sheet and can be accessed only by tearing the two apart as if it were a payslip. This is based on a pressure-sensitive process which transfers marks on the response sheet to the backing one. When torn apart, a grid is revealed. If responses fall within the areas of circles, squares, or even triangles, they can be counted and totaled. For some questionnaires, the responses which fall within different bands of color or shading are totaled to provide raw scores for scales. The 16 PFS and 15 FQ Plus use this process. The disadvantage is that often people do not apply enough pressure to transfer their marks, and it is important to mention this to them before administration. Objective and subjective scoring. Objective scoring is scoring a test by means of a key or formula so that different scorers will arrive at the same score for the same set of responses. An objectively scored instrument is one where the correct answers are counted and that they either are or they are converted to the final scoring. Such tests may be scored manually or using optical scanning machines, computerized software, software used by other electronic media, or even templates that are placed over answer sheets where a person counts the number of correct answers. Next is interpretation. So, psychological measurement is the process of using tools to evaluate one or more psychological trait or variable. Psychological traits include personality traits and emotional function as well as cognition. Cognition is a term that includes the process of attention, learning, memory, language, perception, and thought. Specific tests have been designed to measure individual aspects of cognition, personality traits, and emotional function. These tests take a variety of forms. Because of the number of assessments that exist to assist in psychological measurement, it is important for practitioners to understand major test descriptors. Next is norm reference or normative and criterion reference. Two key testing descriptors are norm reference and criterion reference. These descriptors refer to the way in which the test is scored. Norm reference measures compare a person's knowledge or skills to the knowledge or skills of the norm group. The composition of the norm group depends on the assessment. For student assessments, the norm group is often a nationally representative sample of several thousand students in the same grade, and sometimes at the same point in the school year. Norm groups may also be further narrowed by age, English language learner or ELL, status, socioeconomic level, race, ethnicity, or many other characteristics. Scores indicate how an individual compares with norming population. Interpretation relies on relative standing with less emphasis on absolute amount of knowledge or skill. Next, instrument needs to be able to make distinctions among individuals. It should be extremely easy and extremely difficult items are not included, though items tend toward the difficult end of a spectrum. Score is generally expressed as a standard score or grade equivalent and need to look very carefully at the norming sample when interpreting results. Lastly, criterion reference tests compare a person's knowledge or skills against a predetermined standard, learning goal, performance level, or other criterion. With criterion reference tests, each person's performance is compared directly to the standard without considering how other students perform on the tests. Criterion reference tests often use cut scores to place students into categories such as basic, proficient, and advanced. Individual scores are compared to a predetermined standard of performance, or the criterion, not with the scores of others. Score is usually expressed as a percentage or pass or fail. This focuses on what individuals can do. This is most result in highly skewed distribution, and it is good for diagnosis.